Hi, everyone.
Go
Hi,
ahead.
everyone. It's Dr. Natasha Iyer here with my special guest, Dr. Shabnam Daskar. She's our Director of Medical Education at our clinic, Better, a medical center for complete living. Now, our clinic is dedicated to your healthy aging and longevity because it's easy to live a long time these days. It's not easy to live disease and disability free. And that's my mantra today and every day. I say to patients, the goal is to live disease and disability free. My grandpa spent his last decade in a nursing home. He didn't know who he was. He couldn't toilet himself. He couldn't feed himself. He had had 5 strokes. And the reason I bring that part up is because we're talking about heart disease today, and this is Heart Month. However, Dr. Carr very brilliantly always talks about the heart and the brain together. You see, my grandfather had cardiovascular disease and cerebrovascular disease. He had high blood pressure, but it affected his brain the worst. My grandma, on the other hand, had high blood pressure, high cholesterol, diabetes, which accelerated her heart disease by 15 to 20 years. That's what happens. And she died after having all of the major complications of diabetes, which is heart attack and heart failure, loss of limbs. So she lost both her legs from the knee down. And she lost 60% of her heart function and really didn't have the capacity to do a lot of movement, because when you move, when you go to the toilet, the sitting down and standing up, that takes increased heart capacity for you to do all of these things. And we don't think about that. We don't think about how important it is to protect all of our organs so that we can do all the things we want to do when we're older. I always tease patients and I say, when I'm 80, I want to wipe my own bum. I want to get on and off the toilet myself. And I want to be able to wash my hair and put my groceries away. So I need to be able to do all kinds of movements. So on that topic of staying disease and disability free and living a longer, healthier life, I'm so honored to have you with us, Dr. Carr, because you are a wealth of information. And being Heart Month, I thought, we really need to get back to educating people.
Thank you, Natasha. That was such a wonderful introduction, and I think you're extremely generous with your, compliments and with and how much you value my knowledge.
True.
Yes, it is Heart Month, and particularly, both of us being women, and I'm a former OBGY, and there is so much we know today about heart risk for heart disease and stroke, so cardiovascular disease in our terms, in women, which are somewhat unique, and they're not, as everyone says, women and any disease, not just cardiovascular disease, even dementia would be a part of that. And so it's not just bikini medicine, it's not just breasts and uterus and ovaries. There are a lot of other things about women too. So, and women are not small men. For a long time, we thought women were small men and women were not studied separately. But we know that there are some conditions which are somewhat, they are relevant for men as well as women, particularly, for example, something like diabetes. And Dr. Iyer was talking about diabetes. Now, Natasha, one of the things that you are a prime example of that. And we always say that your genes don't decide your destiny. So given that, you are of South Asian ancestry like I am, so by default, we are at a much higher risk for cardiovascular disease. And both your grandparents had cardiovascular disease. They
Well,
had,
both my parents are diabetic.
both your parents have diabetes. And I
Most of
know
my
you have,
family have struggled with
yes.
obesity. They have high blood pressure, cholesterol problems, thyroid problems, depression, all of those things. And yes, you're right. I work very hard at my health to be on no medication and to not have any of the things that people say, oh, you're an Iyer, you're going to get
No, no,
or this or
no.
that, right? And I'm like, I'm opting out of that one. I am
Yeah.
not having that happen.
No, it is so true. Like any South Asian family you look at, like it's almost they kind of expect, like I'm this age, I'm going to have diabetes, I'm going to have cholesterol, as if that's a disease. I'm going to have hypertension. I said, no, that's not true. I mean, you are a prime example of that. And in my own family, I have, cousins who passed away at like 50, younger than me,
Wow.
from a heart disease, like sudden cardiac death. I've had uncles who've gone, who've had diabetes.
Mhm.
But then so far, fingers crossed, I don't have diabetes yet, and I
No,
intend to
you're
stay
not
that
going
way.
to get it. So, Dr. Carr, thank you for sharing that, because your genes are not your destiny and you don't have to get the things that run in your family. That's the first thing.
Absolutely.
But today I just wanted to focus on one thing in particular, which is a combination of, it'll involve some diet and supplementation and the testing around it. Because I think we should do a basic course for the average person who just goes to their family doctor, and most of our patients are beyond that. So this is for
Yeah.
our patients today. And so I wanted to fine tune a little bit of our discussion on, this whole thing about the low fat, the heart association endorsing oatmeal and cereals and things like that. Cardiologists telling their patients, I know I laugh at that too, but we should maybe be careful.
Yes.
That
I hope they're not listening, Natasha.
cardiologists telling their patients that um, low fat is best, margarine instead of butter. I take offense, and I have no tact or skill around discussing this, because I eat bacon and eggs and high fat every single. I mean, I don't eat bacon and eggs every day, but I would, if I wanted to.
Yeah.
But yesterday's stew I cooked had bacon in it. We eat eggs for breakfast. We eat pancakes for breakfast. I don't eat 3 eggs a week. I eat 6 or more eggs in a week,
Yeah.
and I have no trouble with my weight. So eggs, my cholesterol at the last check was 4.8, my total cholesterol. My HDL was 1.3, which is excellent, right? My triglycerides were less than 0.7. My non-HDL, so my cholesterol panel is pristine. So if eating an avocado every day, eating my lamb cooked in its fat and drizzling the fat all over it. I mean, today I ate ground lamb with zucchini and some sweet potato. And I had coconut oil on the sweet potato and all the lamb fat in the lamb. Plus I ate an avocado, and for dinner, if I get dinner, because I'm on call, uh, but dinner will be a meat, a lot of fat, and vegetables, right? So if a high fat diet really raised your cholesterol, I should have high cholesterol, because
You
when I
should
drink
have
my
had a heart attack by now, Natasha.
I
And
am, and I'm 49 years old this year, and look at my numbers, right?
yeah.
My sugars run at 5, which are optimal for longevity.
Yeah.
And so I can say that, and it sounds like I'm showing off, or I might be just that one person, but I'm showing off to show you that you can eat a high fat, ultra low carbohydrate diet. Now my sweet potato portion might have been 4 small cubes of sweet potato with my lamb today, right? So that's less than a quarter cup. But I will eat carbs once a day, if at all. Today I'm eating carbs because I run short on sleep when I'm working all day and all night. And I manage my carb intake based on how much I'm sleeping, how active I am, and those sorts of things. But usually I wouldn't even eat sweet potato with my meal. So here I am on an ultra low carb, high fat, high protein diet. And there's no heart specialist telling their patients that. They're saying low fat. And, I add olive oil to everything. I add coconut oil to many things. I use a lot of ghee, which is clarified butter. We're all allergic at home or sensitive to cow milk protein. None of us do well with cow milk protein. So we do all of that. So do you have anything to say to our audience about this whole thing to do with good fats, bad fats, low fat, and heart disease? I mean, I just said it, but I mean,
Yeah.
you have lots to add from a data perspective and a science perspective, and you validate the things I say because you do all the research for our clinic and yours,
Thank you.
right? So do tell.
So again, this entire conversation about saturated fat is killing you kind of thing. So that is not correct. And now, I mean, we have plenty of studies to support that. In fact, just 2 weeks ago, study came out. This is a very big study, I think more than 1.4 million people, where they found that people who ate refined grains, and we know that, I mean, they have a much higher risk of dying and heart disease and everything. And this same group, the Pure study, a few years ago, 2017, they came up with, high carbohydrate diet is related to mortality, not saturated fat. Okay, granted that these are not, causation studies, because they are like many countries, and you cannot do causation studies in the sense that uh, by causation studies, it's like this people ate this and they, fell ill. No, these are like the strength is in the numbers, number one.
That's right.
So
So
we already have
1.4
studies.
million people is a lot of people.
Yeah.
The other thing is it becomes so complicated talking
Yeah.
about diet. Years ago, it was the Okinawa diet. If you wanted to live as long as the Okinawans, go do what the Okinawans do. And I'd say to patients, but you live in Canada.
Yeah.
Right? Like you're here, you're not in Okinawa, and you don't have the Okinawan genetics. Right? Now we can take some of their lifestyle and some of their habits, and we can learn things from them, but we can't go follow that precisely and expect the same results. It's because of that whole triangle that I teach patients about: your biochemical individuality, your genetics that influence you, your stress, your nutrients, your nutrient stores, your hormonal balance. There are so many things that will affect your outcome. And people will often say, I was doing this and doing so well, Dr. Iyer, and now I had to come see you because nothing's working. So why is it that what worked for you before is not working for you now? There's a good reason. Right. And so, we learn things about populations and about health and that. But I find that for every study, as good or bad as it might be, it's not always precisely accurate, and you can't hang your hat on that one thing, like Ansel Keys saying that cholesterol and saturated fat are going to kill you. It was a study, but it was very biased and manipulated in how the data was presented and processed. And there's many, many studies we can talk about like that. But I think the proof of what you're saying is what we know, because we see it every day in our practice. We cannot feed people lots of grain. It should not be on the food pyramid in any substantial form, because it helps insulin resistance get worse. It raises blood sugar levels and dysglycemia, which we said anything to do with insulin resistance, pre-diabetes, and diabetes lead to heart disease, lead to early death, lead to disability and disease. Right?
Absolutely.
So from this study, though, I think you're saying, 1.4 million people, grain is a problem, which, again, you'll have to talk, not that we have time today, but now we have to talk about vegetarians who predominantly eat grain and legumes and cannot do without. So what will they eat?
So before I go into vegetarians, let me just finish a little bit more about the fat part of it. So we call, things in like what are the good fats, what are the brain healthy fats, and so there is no different brain healthy fat and heart healthy fat. It's like good fat and bad fat. So bad fat, trans fats, all trans fats are bad. And the other big thing, which not a lot of people, and particularly I think in Western medicine, not a lot of doctors talk about, is vegetable oils. So vegetable oils are, number one, highly inflammatory. They are really the bad ones. So all these canola and the processed seed oils like sunflower oil and all those things. Whereas, so when I talk to people, and just as you do as well, I usually ask, what was your traditional oil? Like, now I have to probably go to great grandparents, Natasha, because even grandparents some of them ate the processed oils.
Well, I'm sorry, Shabnam, but when I was growing up, we only had sunflower oil in our house. That's all my mother cooked with. And she cooked a curry every day. Okay, not every day, because she tried to keep us kids on a more Western diet, and then my dad on his traditional East Indian diet, right? And so, but the curries always were cooked with sunflower oil, and you'll see it across the board in every relative's house.
Oh,
And I don't mean to be
comes with a heart
disrespectful, but
healthy
it's just a,
sign, Natasha.
that's right. And it has the heart healthy sign on it, which is a big issue for me. And why, when people come to my house and say, would you like to donate to the Heart and Stroke Foundation? I'm like, absolutely not. But if you had a foundation telling people not to do what they tell you to do, then maybe I will contribute to that, right? Because we've got heart healthy signs on margarine, which is made from vegetable oils.
Oh.
And the latest data on vegetable oil is it promotes insulin resistance as well. So to your point, Dr. Carr, thank you for bringing up vegetable oils.
So one is, of course, vegetable oils are very bad. And that is like, it should be a no-no for everyone. I mean, all across, there is no exception. Trans fats are, of course, bad, that everyone knows.
And you know, one interesting thing about trans fats is that even that again is an issue, because something can be labeled no trans fats, but there's a certain percentage below which they can include it and not mention it on the label, which I think is absolutely preposterous and misleading. But you know, that, you know, I get very passionately angry about things when it comes to health and misleading the public and what to do, right?
They can't explain that very well, the portion size. So when you're reading nutrition labels, it's like, I'm sure there is an app which has, you know, which can help, because quite often I find myself standing at the aisle, you know, and I'm looking at this. So 20 grams is one serving contains this much. And then you'll find that there's something else, which is like one serving is 10 grams and trans fat is below the, you know, the approved level, and it can claim that it doesn't.
And how ridiculous, because when you read the serving size, you know, those small bags of cookies sometimes, and we don't eat cookies because we're all gluten-free and we're paleo, so we're grain-free as well, right? But you know, it'll say one serving size and it's 3 cookies. Who the heck eats 3 little cookies? Do you know what I mean? So thank you for that part as well. But I just say to patients, how can you not have trans fats in it if it can sit on the shelf a long time? Because trans fats have to be in it to extend the shelf life. So we want you to be careful as our clients, as our viewers, with what you eat. And I just say to my patients, whether you can comprehend going grain-free and carb-free and whatever, first start. So here's step number 1. Start eating food the way God or Mother Nature made it. So God didn't make cookies. God didn't make bread. He didn't make pasta. And thank God he made wine.
Thank you, Natasha. So for those of you who don't know, both of us love red wine. Okay, so going back to the different types of fat, you know, and as you must have, many of you have heard Dr. R talk about this, we always say, you know, why should you guess when you can test? So we have a test available, which is called the Omega Index, which can measure your blood levels of omega-3 fatty acids, omega-6 fatty acids, trans fatty acids, and a whole bunch of other fatty acids. So some of you actually may be surprised to find out how little omega-3 is in your blood. So this is for people who not only eat fish regularly, and I'm coming to eating fish, also supplement. So there are many different ways of looking at it. So why are we talking about omega-3 fatty acids today? Because one of the things, there are several things which, you know, now the other thing of going back to cholesterol. So heart disease and stroke has about 400 different risk factors, out of which about 25 are modifiable. And cholesterol is one risk factor, and it is not total cholesterol or good cholesterol or bad cholesterol. It's what we are doing to the cholesterol. So inflammation is a much higher risk factor. So after that, when we talk about women, you know, having diabetes, or even having diabetes during pregnancy, so pregnancy diabetes, and you don't develop diabetes in the next 10 years, even that puts you at a much higher risk for heart disease and stroke. So diabetes is a much higher risk factor for women than men. So it's not good for men as well.
We're doing a webcast on insulin resistance and diabetes. So I'm just going to bring you back to cholesterol and then the omega index, because that's what we were on.
So before going on to the omega index, the other risk factor that I want to mention, because it's also related to the omega, is high triglycerides. So high triglycerides is a much bigger risk factor than your HDL and LDL, your good and bad cholesterol, if you are a woman. And high triglycerides, as we know, are also related to how much carbohydrate you're eating. And each person has a different level of carbohydrate tolerance. We'll discuss that on some other webinar. But high triglycerides and diabetes are two of the major risk factors for women. And this is for, high blood
For
pressure
everyone. Yeah.
for everyone, but more so for women. And that is where, the omega-3 index comes in, so, intimately related to this, because high triglyceride levels, besides diet, can also be reduced by using omega-3.
That's right.
And
And in my preliminary video to get people to sign up for the webinar, I mentioned that, like I said, we're going to do the webinar on insulin resistance and that. And I totally lost my thought. You said?
I said omega-3s.
Right. And I mentioned Valskepa, which is now being prescribed, and it
Mhm.
costs between $300 and some dollars a month
Oh,
as a prescription
oh,
medication,
wow.
and it's EPA only.
Yeah.
So I mentioned that, for brain and heart tied together, we need EPA plus DHA. I
Mhm.
mentioned that vegetarians cannot convert their omega 6s into DHA.
Mhm.
So they might convert 6 to 15% into EPA,
Mhm.
but how much omega 6 do you have to have, which is inflammatory, to
Yeah.
make an anti-inflammatory, and the ratio is all off. So by the time you take in enough omega 6s to make enough omega 3s, your inflammatory ratio is still off.
Okay.
And I'm waiting to see the data on, the proof of the pudding will be somewhere down the line with this whole vegetarian vegan movement, because I cannot believe that vegans and vegetarians can outlive people who eat meat. Because one, or not outlive, everybody can outlive anybody today, because medicine can keep you alive
Yeah.
almost forever, right? Like till you're 100. It just means you might have someone feeding you, wiping your drool and wiping your bum, right? Like that's it.
Yeah.
But when you're looking at, and I'm not anti-vegetarianism, don't get me wrong, I have nothing wrong with someone making a philosophical and ethical choice to whether they think it's going to save the earth, which it's not. But if they don't want to kill an animal, they don't want to hurt something, they don't want to do that, that is fine. But the fact of the matter is, we are omnivores. We were made omnivores. History has concisely proved it. There is no way to dispute that we developed the ability to think, to communicate, and do all of this only when man started eating meat, right?
Mhm.
And we need omega 3s for many things, including cell membrane, including protecting our brain and our heart. But we need EPA and DHA, not EPA only. Now, a cardiologist will tell you one thing: you just need the EPA because it's anti-inflammatory and it's heart healthy. They don't know about the brain. They don't care about the brain. When you did obs and gynae, you didn't care about anything above the bikini line.
No.
You had no clue what affected a woman's heart, what affected her brain. You didn't know anything about depression, postpartum. None of that occurred to you because you were a baby doctor and a below the bikini line doctor. So anything there, you knew everything about it, but you didn't know enough or care enough about anything else because that wasn't your field. And I don't mean it in a
No, that is
respectful
true.
way that you didn't care, but you didn't care
You didn't.
because
I
you had
didn't
to care
know.
about what you did, right, and what you were doing. So coming back to this whole thing, you have the opportunity to eat fish, which I don't think you should eat a lot of on a regular
Yeah,
basis because of
I'm
how
coming to that.
contaminated it is, and all of the other PCBs and chlorinated hydrocarbons and organic compounds and chemicals that are found in fish and all of that. So I personally do eat fish. I feed my children fish, but in very limited amounts. And um, they love canned fish, which is an issue, right? They love their little cans of tuna. So that being said, I think if you're going to take something, why spend money on a prescription drug that is so one-sided and not optimal for you? Then take a proper omega supplement, which is balanced and proven to be heavy metal free, PCB free,
Yes.
toxin free, and very potent and bioavailable. You can get a lot of different things I had a patient just say this to me the other day because she brought me her supplement. And I said, look, your omega-3 is showing you heavy metal free in parts per million. And if you understand anything about dilution, it means that if it's negative at parts per million, it can still be positive at parts per trillion, right? Because of the dilution factor. So telling someone it's negative at parts per million is fine. But what we recommend is parts per trillion negative, so that you know for sure. Remember, you're taking this every single day. Over time, if it's contaminated, it's going to accumulate in your body. And where does it go? To your heart and your brain, right? And so you want to be very careful and precise about what you put into your body, even natural supplements, because anything labeled natural doesn't mean it's safe. Just like if it's labeled heart healthy doesn't mean it's safe or good for you. You need to do your own research. Now, thankfully, we have you and a whole team of experts at our clinic doing research a lot, all day long, in the fields of nutrition, healthy aging, diet, supplements, and everything else that we do. So when we give patients information, I can trust that it is good information and solid information. So in particular, the omega supplement at 1,300 milligrams, you only need 3 a day to get to your dose that's recommended to lower triglycerides, to protect you from heart disease, to cross the blood-brain barrier, get the DHA into your brain for brain protection, Alzheimer's disease protection. So I'm really fond of high quality pharmaceutical grade supplements that I know what's in it, or I won't take it and I won't give it to my kids. And I love that you had found us this particular nutrient at this type of quality and this type of price, because you're looking at $80 to $160 a month versus 300 to 600 and some dollars a month, right?
Yeah, that is very important. And another thing I just wanted to point out is omega-3 fatty acids are called essential fatty acids, which means your body cannot make them. So if
Thank
your
you.
body cannot make them, you're welcome. You have to eat them. Okay, so just now, Dr. Iyer talked about the problems of fish, and the standard recommendation, I think, salmon and fatty fish are very high in omega-3s. So you can just have, fatty fish twice a week. Okay. Now, twice a week fatty fish, let us say you're getting, wild sourced salmon. So they, few years ago, I think it was 2014, they did a study where they looked at, fish from different areas where they were farmed or wild or all of that. And the amount of omega-3 fatty acids varied in them like across the board. Like it was like from 800 milligram to I think 1500 milligram. So how are you going to find out, number one, how much is there in even in the best, wild salmon that you're having, and you're having just twice a week? So what is going to happen the rest of the
I
time?
kind of like my brain working and fueled all day long, every day. And my heart protected every day, but I will not eat fish every day. And I will not follow the Eskimo diet either. Because years ago, that's what we learned, right? The Eskimos don't get heart attacks because of the amount of fish and omega-3s that they have.
But we are not.
And they eat no vegetables.
Yeah.
They eat no vegetables.
Yeah. So this is where, Dr. Iyer and I always talk about why guests, we can measure. So number one is measuring. The other thing is, Natasha, you keep bringing up the brain because, both of us are so interested in the brain. We want to have a fully working brain all our lives. So omega-3 fatty acids in the brain are so important. And, the complete turnover of the omega-3s in the brain, and DHA and EPA, as Dr. Iyer was talking about, DHA, so remember H head. So EPA, the prescription medication, doesn't contain DHA. So your heart is protected, your brain is like, it can go wherever it wants to go. So you do need a combination of EPA, DHA, but instead of guessing, you can measure, number one. Number two is the brain turnover can take longer time. And the other interesting thing is, none of these nutrients work in isolation, because when we eat food, we don't eat like only omega-3 fatty acids and don't eat anything else. So
There's
for
protein and amino acids.
So for omega-3s to work well, particularly in the brain, you do need adequate B vitamins as well. So these are studies showing that. So these are the two big things. So if you don't supplement, how is your body going to make that? Because omega-3s, the body doesn't have the ability, even in people who eat fish. And people who are vegetarian, most of them will not convert, like you said already. So if you are vegetarian, and I have a lot of patients in India who are like culturally vegetarian, they're not going to start eating meat and fish.
I do too.
That's,
Yeah.
yeah, so that's why it's very important to supplement. The other big one is, of course, B12, because if you're a vegetarian, you're not
And
going
I
to.
don't agree with taking B12 by itself. I think in
No.
nature it occurs as a
Yeah,
complex, and we
yeah,
must always take a B complex
yeah.
and not just something in isolation. But I think that's what people are going to find out about when they book their consult with you. So if
Mhm.
you're interested, drop us a line. We'll leave a link below the video. You can send in your contact and we will help you access. So what we've got for you is a heart and brain healthy consult with Dr. Carr that includes one, a risk factor assessment. So you'll
Yeah.
get a document and you just fill in all your stuff and it'll tally for you. I think it tallies, right? And tells you from your score how at risk you are.
Yeah,
You'll
I
get
go
this
over the
omega
score.
index
Yeah.
test done, and then you will get to talk to Dr. Carr and identify your specific cardiovascular risk factors and the steps that you need to take to get them reversed. And I think that is the most important thing. People don't realize that you can reverse your risk factors
Oh,
for heart disease. They don't
absolutely.
realize that when you have heart disease, we can still help you reverse it.
Yeah.
And we absolutely can guarantee you that if you do what we tell you, advise you to be more polite, but do what we tell you and we will stop it from getting any worse. And Wendy was saying we could use her story. I'm just going to bring Wendy into this. You know, Wendy years ago was a vegetarian. She does not believe in harming animals. She does not believe in killing things. It hurt her heart to do that. And she ate vegetarian. She came in and she had ulcerative colitis, so an autoimmune disease. She had other risk factors. I'm not going to go into those. Stress would absolutely be another one of them. She's a very sensitive, emotional person as well, so she's easily bothered. So we know that these types of things will make you at higher risk, right? And her triglycerides were high. And I said to her, I said, Wendy, you are a prime candidate for cardiovascular disease. You need to change things now. And her biggest thing to me was, I cannot change what I do because when I'm out at dinner and we socialize a lot, I don't want people looking at me odd for changing this or asking for that. And I said, do you know what I do in a restaurant? I don't give a flying hoot about other people. I'm going to eat what I'm going to eat and I'm paying for my meal. So I'm going to ask them to make it exactly how I want it. If we're in a group and people are sharing things, I just tell them, I would love to share with you, but I'm particular about what I can and cannot eat. Sometimes, depending, I might just throw in my food sensitivities. I call them allergies. I might say I'm just allergic to many things. So if you want to share, share with me, but I can't share with you. You know, there's polite ways. There's other things you can do, like carry little things in your purse or your car and eat before you go, so you don't have to have a great appetite and eat everything that's there. You know, there's a lot, but we can teach you all of those things. Let me tell you what happened to Wendy. I met Wendy years ago, and I think it was three years ago. She had been to the emergency department multiple times with complaints. Nobody picked up because she's not a small man and she didn't have your classical
No,
symptoms. They missed that she was having cardiovascular disease presentations.
this is
Eventually,
so
she
common.
ended up
Terrible.
with a 90% blockage in a vessel, had to get airlifted to a hospital because she lives in a community that doesn't have cardiology, got a stent put in her heart, all from something we warned her years ago was going to happen. And she needed to lower her triglycerides and she needed to take her health seriously. Now, a few learning key points from this case. Her cardiologist told her that there was no such thing as worrying about triglycerides.
What?
Yes. So she phones in a panic going, see, I don't know who to believe. I don't know what to do. Like this person just told me that it
Yeah.
doesn't matter. And I'm like, Wendy, I'm not even going to show you the medical studies. Why don't you just go to Dr. Google and put in
Yeah.
triglycerides and cardiovascular disease and see what shows up? And so I did it for her and showed it to her on Zoom because she doesn't live in Calgary. And I'm like, look, this is what Dr. Google shows you, not even me. And so your cardiologist needs to go back to school. I'm sorry to say that. Like your cardiologist needs to get his or her nose out of their ass and start reading current data. Don't go to someone who doesn't know what current medical traditional information is. I mean, we're not asking them to have functional medicine knowledge. We're saying just have basic knowledge about heart if that's your field, right? So that was the first thing. The second thing is at the time of the event, she was on testosterone because we specialize in hormone replacement therapy for healthy aging and longevity, right? And for feeling your best. And you always say to me, I don't have a brain if I'm not on my estrogen. Well, Wendy didn't qualify for estrogen because her natural levels were being maintained. But I had her on testosterone and DHEA, neither of which are estrogens, right?
No.
And another cardiologist tells her to get off her hormones because hormones caused her heart attack. So again, she's in a panic and she wants to get off her hormones and do all of these things. And I'm sort of going, okay, Wendy, the North American Menopause Society even came up with consensus guidelines. We now know that hormones protect your heart. We know that the old news was when people were taking oral estrogen, it can increase your blood thickness and stickiness, so to call it. We knew that oral estrogens caused other issues, but we also knew that it was the synthetic Provera that was the bigger confounder and cause of all the issues. And that's when women were told across the board, get off hormones. But 20, 25 years later, it's all changed. The data we have, the information we have is different. We know that transdermal hormones protect women. We know that hormones, tell us, Dr. Carr, do hormones reduce your risk as a woman for heart disease?
Yes, and not just heart disease. It's also dementia. It's also, of course,
Right, but
bones.
but
We
for
already
the
know
heart,
heart disease for sure.
will being on bioidentical hormone therapy with you and I, will that give a woman an increased risk of a heart attack?
No, no. In
Absolutely
fact,
not. And on top of
Natasha,
that,
this is like I just wanted to point out because we've run out of time that there is a window of opportunity. So if you start hormone therapy earlier rather than later, that gives you a whole lot more advantages.
and
It doesn't mean you cannot
had
do later.
Wendy had started
Hmm.
the journey into hormone replacement
Yeah.
therapy, but didn't need the estrogen. But this is how ignorant the cardiologist was, because I said to her, I said, okay, so which hormones are you talking about? She says, I don't know. I just said I was on hormones. I said, did he ask you which one? No. So the cardiologist never even established if
Which
she
one?
was on oral estrogen,
Yeah.
but told her to get off of it. Now, on that note, I will bring in men because I was just listening to a longevity expert today, and it was on whether testosterone extends lifespan and does it,
Mhm.
and so we would all love to say that all hormones make you live longer. No, all hormones make you live younger, and we balance it to optimal levels
Yeah.
for you. And testosterone is critical for helping men balance their blood sugars and reduce their risk for diabetes, and it helps with cardiovascular health. So men and women both require hormone therapy. As they drop their levels, we need to, in that window of opportunity, restore levels so you can live disease and disability free. At the same time, will help you live longer, but there are other things that have been shown to help lifespan. I'm only interested in health span. If I live to 80, it must be a good 80 years. If I live to 95, it must be another good 15 years. I don't want those 15 years in a nursing home. So that's the point we're making. And it begins with looking after your heart, your brain, and everything in between, from the tip of your hair down to your toenails. But that being said, do book in with Dr. Carr. Do book in for this heart assessment. Get your omega-3 index. You will be shocked. You might think you take the supplement every day, and that's what I was saying about the patient who, we're talking about parts per million and parts per trillion. And she said, oh, you mean I've got the Kia when I should be in the Rolls Royce? And I said, if you want to live a long time, disease and disability free, then you only put Rolls Royce material into your body. Except, wine doesn't count. And there's studies that say wine is good for your heart and good for your longevity. So we will leave it at that.
We'll have the wine conversation over a glass of red wine. But, well, both of us are not suggesting that you just drink yourself silly, but
Absolutely
anyway.
not. No.
So, Natasha, could you just, which email address should people, send an email to if they
We're
want
going to have a link attached when we post the video, Dr. Carr, but it's always easy to email info@betterforlife.ca, and it's better numerical 4.ca.
Thank you. So thank you very much, and see you again another day.
You
Thank
were my guest, and I talked more than you, Dr. Carr.
Oh, no, we both talked equally. Bye now.
Thank you.